For our next two talks, we'll actually have Dr. Salim Ghazi, who's the chair of our pain department at Mayo, Florida. He's going to be first talking about the opioid epidemic in the U.S., followed by spinal cord stimulation and drug pumps.
Good morning, everybody. It's a pleasure to be with you today, and you're going to have to survive me for a whole hour. 2 lectures. I think the first one is going to be okay time-wise. The second one, I may have, my dilemma was the time, or 30 minutes to discuss the next one, but we will get to it later. So, I'm Dr. Ghazi. I'm a pain specialist. The background is anesthesiology, and I've been with the Mayo Clinic for 24 years. I work with wonderful people in the Department of Neurosurgery, Spine Department, and PM&R. This lecture was supposed to be about injections, medications, as a continuum to physical therapy when somebody shows up with back pain. So you would have, as a first line of defense, we call it, conservative approach with medication and physical therapy, and then injections, later on interventions like pumps and stimulators, and finally, if we can save them from surgery, then surgery. However, because of what was going on this year with the CDC and the opioid epidemics, I thought, you know what, why don't we discuss the opioids? Why did the CDC do what they did? And how bad was that opioid epidemic? And so we can learn lessons not to be repeated later. Because in the United States, I realized the pendulum sometimes swings big time one direction and then big time the other direction. This time it was okay. The accent is Lebanese. If I can show you how I used to look, 30 years ago, that's me right there. In Beirut, 1986 was my graduation. We're going to skip the video of the Mayo Clinic, Florida, because you're all local, I guess, or you know the area and you know the Mayo Clinic exists in Florida. The opioid crisis in America, my job today in 30 minutes is to tell you how it started, what the CDC guidelines were, and why the CDC did what they did, and what did the Mayo Clinic do to accommodate to that. Since it's a story, and by the way, I have nothing relevant for this lecture. Since it's a story, I'm going to start it as a story. In the United States, we go, once upon a time in the United States, there was a wonderful country when people were living most of the time in harmony together, enjoying the goods of the country. Some of those goods were even better than other goods. And all the way up to the 1920s, people were not restricted in using opium and alcohol and moonshine. In the 1920s, after the Second World War, the more powerful government, medicine